This video is intended for patients pursuing in vitro fertilization treatment at Walter Reed Bethesda to review basic information about genetic consultation and screening that is available during this process. Any baby has a small chance to have changes in development that may affect physical or intellectual abilities. The chance to have a child with a genetic condition or other changes in development may be increased if there is a genetic condition running in the family, with increasing age, with possible exposures during pregnancy, with multiple gestations such as twins, or certain health conditions of the mother such as lupus or gestational diabetes. Genetic screening prior to pregnancy offers the opportunity to identify if an individual or family has an increased chance to have a child with certain genetic conditions or changes in development. In most cases, results of genetic screening or testing will not significantly affect your fertility care or timing of procedures. It's available in case you want to know if your chance is increased to have a child with a change in physical or intellectual development and may wish to consider additional options in your fertility care that may reduce this chance. Genetic factors may contribute to unexplained infertility, male factor infertility, primary ovarian insufficiency or diminished ovarian reserve, or recurrent miscarriage. If any of these apply to you or your partner, or if either of you or one of your family members has a genetic condition, change in physical or intellectual development since birth, or has been identified with a chromosomal rearrangement or found to be a carrier of an autosomal recessive condition, you should be offered an individual genetic consultation. At that time, you would meet with a genetic counselor who would review your family medical history in detail, discuss any and all genetic test results, and may offer additional genetic testing. Some of the most common tests offered to fertility patients include chromosome analysis of the patient and/or partner, Y chromosome microdeletion studies for men with male factor infertility, and Fragile X carrier testing for women with diminished ovarian reserve. Other testing may be made available based on patient and/or family history. The remainder of this video will primarily focus on general population carrier screening, provide a brief overview of testing options available in pregnancy, review factors to consider in deciding whether or not to pursue further genetic consultation or testing, and provide resources for each of the conditions mentioned. Carrier screening will be offered as a routine part of fertility treatment and refers to blood test screening for some of the most common autosomal recessive genetic conditions that are more common in certain ethnic groups such as sickle cell disease, cystic fibrosis, Tay-Sachs disease, or thalassemia. Autosomal recessive conditions are conditions that involve genetic changes in both copies of an individual's genetic instructions. Since both are changed, it causes the instructions to work differently, which cause symptoms of the genetic condition directed by that instruction. Most often, this occurs as a result of both parents of that individual being what is called a carrier of that genetic condition. In other words, of each of the parents' pairs of genetic instructions, one copy is changed and the other is not. As long as one copy is working as expected, that parent is not likely to know he or she is a carrier without having a genetic test performed unless they give birth to a child with the recessive condition. Each parent passes on just one copy of his or her genetic instructions to each child. For two members of a couple who are both carriers of the same genetic condition, they have a 1 in 4 or 25% chance that any child they have together will inherit both changed instructions and will be affected with the recessive genetic condition. This same couple also has a 1 in 2 or 50% chance that only one parent will pass on the changed instruction, and those children will be carriers of the condition just like the parents. This same couple also has a 1 in 4 or 25% chance that any child they have together will only inherit the non-changed instructions and will neither be affected with the recessive condition nor be a carrier. Anybody has a small chance to be a carrier of any genetic condition. However, there are certain recessive conditions that are more common to different areas of the world. Your reproductive provider will ask about your ethnic background to determine for which autosomal recessive conditions you have the highest chance to be a carrier based on your ancestry. While ethnic background is used as a general basis to determine what testing should be offered to you, it's important to let your provider know if anyone in your or your partner's families has a known genetic condition. Additional carrier testing may be offered to you based on your family history. In considering whether or not you may want to identify if you are a carrier of any of these conditions, you may wish to learn a little bit more about what it means to be affected with or have a child with one of these conditions. This table provides a very brief overview of each of the common autosomal recessive conditions. Most of these conditions begin causing symptoms in infancy or early childhood. Most have treatments available, but none has a cure. And a few lead to significantly shortened life expectancy, some as early as infancy or early childhood, while others are expected to survive to at least early adulthood. Additional web resources that provide much more detailed information are available at the end of this video. In the process of preparing to have IVF, you will be offered population-based carrier screening for common autosomal recessive conditions. If you have had this performed previously, in most cases it is not necessary to repeat. Carrier screening involves having a blood test on which DNA testing will be performed to look for the most common changes in the genes responsible for the specific genetic conditions. If you choose to have testing and your result is negative, meaning that none of the common changes were found, this significantly reduces your chance of being a carrier for that condition. However, no general carrier screening is 100% effective. It is possible to have a negative test result but be a carrier for a rare genetic change not included in routine testing. If you are identified to be a carrier, you should be referred for individual genetic counseling to review this result and discuss the testing options available for your partner. It may be helpful to know that newborn screening is available to be performed on babies shortly after delivery and includes testing for sickle cell disease and cystic fibrosis, regardless of ethnic background, family history, or parental testing. If your concern is for the other conditions, you may request a separate blood test be performed after the baby's born as well. When both members of a couple are identified to be carriers of the same autosomal recessive condition and are known to have a 25% chance any child they have together will be affected with that genetic condition, there are several options that may be considered before pregnancy begins to reduce the chances of conceiving an affected child. A couple may consider using a donor gamete, such as donor sperm or egg, of someone who tests negative for the condition of concern. Pre-implantation genetic diagnosis, or PGD, is genetic testing that can be performed on a single cell removed from each embryo to identify which embryos contain instructions for carriers, would lead to a pregnancy of a child affected with a genetic condition, or neither, to help a couple decide which embryos to transfer or possibly freeze for later use. When both members of a couple are carriers of the same genetic condition, they may wish to consider pursuing adoption instead of IVF. If none of these options are utilized, there are additional options during pregnancy or after a baby is born. During pregnancy, procedures such as chorionic villus sampling and amniocentesis may be performed to obtain cells from the pregnancy to test for the known genetic condition of concern. If a pregnancy is affected, parents have the option to consider pregnancy termination. Even if termination is not an option for a particular individual or couple, they may still wish to have testing during pregnancy to allow for advanced planning and preparation. Parents who do not believe they are able to raise a child with a particular genetic condition may also consider placing the baby for adoption. Other parents may want this information to maximize treatment and for anticipatory guidance. Some of the testing options available during pregnancy will be briefly reviewed. Some parents feel strongly they would want to know about certain genetic conditions during pregnancy. Diagnostic testing, such as CVS and amniocentesis, are available at Walter Reed Bethesda. These are procedures that involve getting cells from the developing placenta or amniotic fluid that allow for direct genetic testing of cells from the pregnancy. This testing is the most accurate and comprehensive available in pregnancy, but also has a very small chance of causing complications that could lead to the loss of pregnancy. Screening tests are ways to get additional information that does not identify for sure if a baby has a particular condition, but does not have a risk for loss of pregnancy. These include blood tests such as serum integrated screening and cell-free DNA non-invasive prenatal screening or testing, NIPS or NIPT. Looking at fetal growth and development by ultrasound during pregnancy can also be useful in identifying if there are any changes that are concerning for certain genetic conditions. There are additional videos available that review more details regarding prenatal genetic testing, basic information about chromosome conditions such as Down syndrome, and further decision-making factors. These can be found on YouTube by searching for National Capital Area Prenatal Genetic Testing. Remember that it will always be your decision whether or not to have any genetic testing performed. When considering whether or not to have carrier screening performed prior to having IVF, think about if it would be reassuring to you to know that your carrier testing was negative. If you and your partner were identified as carriers of the same autosomal recessive condition, think about if you might consider using donor sperm or egg, coordinating genetic testing of your own embryos prior to transfer, if you would want to know to coordinate diagnostic testing during pregnancy or following delivery, or if it would be useful to know to consider adoption. As stem cell research advances, some couples may wish to know this information to help decide whether or not to pay for private cord blood banking. Some couples may not consider any of these options, but would like to know to begin to adjust their expectations and seek additional information and support. If you wish to schedule an individual consultation with a genetic counselor, please discuss this with your reproductive provider so that a consult request or referral may be entered on your behalf. You may schedule an appointment at Walter Reed through the Prenatal Assessment Center at 301-319-5050, or find a genetic counselor in your local area through the National Society of Genetic Counselors website at nsgc.org. You may also direct questions to any provider using the secure online web portal Relay Health. And you can get additional information regarding any of these conditions discussed in this video at Medline Plus, or at any of the following websites dedicated to providing support to individuals with these genetic conditions